All right. Thank you all for being here. Really pleased to be here with my colleagues, Jill and Marcel. Marcel, by the way, is grandfather with his second kid, just born yesterday, earlier this morning.
That's yesterday.
Yesterday. Congratulations to Marcel.
Thank you.
A couple things we wanted to kick off with before we get going. First, for those of you who don't know us, and I think most of you probably do, but if you're new to our webinars and you're new to Santis, we're really proudly Canadian health consultancy that operates across the country with a footprint in our major cities from Victoria, Vancouver, all the way across to Halifax. We do provide a number of services from government affairs, management consulting, and communications. We will just keep rolling. We'll walk through a little bit about today, but we wanted to make sure that we were able to articulate what this means to the sectors that we support. Anything from healthcare delivery organizations to governments and health authorities to different types of organizations, health professional, health charities, patient advocates, life sciences. If you're in the healthcare sector, we're proud to be able to work with you, and this is the community that we get to work with. So thank you all for being here, and thank you for being part of our community. We're really happy to be able to talk today about what's happening coming out of the federal budget. A couple housekeeping pieces. If you have a question, there's a Q&A function in the chat here. I'm just looking now. Please feel free to use it so that we can answer your questions. There it is, the Q&A chat. We'll make note feel free to ask questions throughout the webinar. We'll keep an eye on them. Some we might just answer in writing because we do have multiple individuals here that will be able to do that. Some will be able to take online. We will hold time for questions at the end, but drop your questions, and especially as we go, because we might be able to answer them as we go, as we're on that topic. We will send out an email following the webinar, get some feedback from you, figure out what we could do differently, better, if there's other topics you want to hear from, different people on our team you would like to hear from. And then also we will be recording this. It is being recorded and it will be sent to you following the webinar, and as well it will be posted on our website. So if you want to share it around to your networks, you're more than welcome to. So I should say, for those that don't know, I'm joined with Jill Pilgrim. Jill is an exceptional member of our team, lawyer by training, served in the government of Canada for many years, everything from Health Canada to ESDC, Director of Policy from Newfoundland, unbelievably smart. Will be awesome to hear her thoughts as we get going here. My other exceptional colleague, who I've had the pleasure of knowing for quite some time now, Marcel Saunier. Those who know Marcel know him well. He's done everything from worked in the Prime Minister's office several moons ago. We don't need to say how many, right, Marcel? All the way through to being the executive advisor on a number of critical pieces of work that the government has done, whether it was the Dr. Naylor Health Innovation Report, whether it was Dr. Hoskins' Pharmacare Report. He was a leader in both of those. I got to know him in Health Canada when he was Associate ADM of Health Policy, and real pleasure to work with him now in the context here at Santis. And then I myself and Peter Cleary have been supporting organizations like yourselves for the last 8-9 years, and spent a number of years in governments, Ontario government, federal government, multiple ministers, health ministers. And in that context, the three of us would love to talk to you today about the budget that we just had. So we're going to do a deep dive into a number of these, but we wanted to just do the quick little flyby at the top, and then we'll get into the meat of it in the following slides. It's categorized as an investment budget. The government did commit to operating the budget in a 3-ish year window. I say ish because I'll believe it when I see it. But it's a very high deficit. And I think that narrative around balancing the operating deficit is critical to articulating the reason why the deficit is higher than it ever has been. Spending is up. But I think, as we will discuss in this webinar, a lot of the spending from the health sector that we've been looking at in the government of Canada is down. I might just open it up though. Jill, Marcel, maybe go to Jill. Is there anything that struck you at a high level that we want to get into before we go into the meat of things?
Yeah, so I mean, I think there are a couple things that really jumped out at me that I wanted to highlight off the top. One of which, as Peter said, we'll get a little bit deeper into the CHT and the bilateral agreements, but right off the top, something I wanted to highlight was the personal support worker investment. The reason I want to call that out specifically is because, as we'll see later on, there is kind of a move that we've seen from this government that they're signaling they may move away from the use of things like bilateral agreements as funding mechanisms in the health space. The PSW, personal support worker tax credit that's included there, I think is a really interesting signal of this. This is primarily funded with $1.17 billion that are, quote, sourced from existing funds. That funding was provided by the previous government and was intended to be flowed to assist PSW wages, but through a bilateral agreement structure. In the time that the previous government had it on the table, I believe it was only 3 jurisdictions that actually signed on. And so we're seeing them move away from that bilateral agreement concept, and instead finding ways to get it directly to workers in a more innovative way. So they're using tax credits to do this. This is an interesting precedent that this government is setting. Tying something to a specific profession like this can always open up the door to lobbying around this space. We've seen it with the Canada Student Loan Forgiveness Program, which was really targeted at physicians and nurses, in which the previous government ultimately had to expand to other professions last year. Now, will that expansion go through? We're still looking into that, but I think an interesting precedent there and a signal of where this government is kind of changing their format of funding in health. The other piece that I also wanted to note was the commitments on healthcare in the North. So no funding tied to this one specifically in the budget, but there was an acknowledgement that the government will undertake a review of healthcare and infrastructure needs in the North to identify ways to increase access and reduce medical travel costs. So Canada has a number of agreements with the territories primarily aimed at trying to offset increased costs and access issues in the North. But what has ultimately happened over the years that these have existed is that it's trying to address the kind of low-hanging fruit issue of the cost of travel, but the funding is more and more going only to that because the cost of travel is increasing so much, and it's not getting at kind of the broader underlying issue of the access issues in the territories themselves. And so I think this will be a really interesting space to watch, because I think one of the discussions that they'll have to be having is, how do we actually get at the access issues so that the need for this travel is actually reduced ultimately? And in a time when the government is talking about, smarter spending and ultimately trying to kind of wean off federal investments in areas that are provincial and territorial jurisdictions, there's a real opportunity there to hone in on ways to spend smarter and build capacity in the North, as opposed to just funding getting people out of the North for care.
Marcel, anything that jumped out at you at a high level before we get into it?
Yeah, I think we'll get into many of these areas in more detail. That the overarching kind of takeaway for me is like this is what a budget from a liberal government that is not focused on social policy looks like. This is a government very focused on economic policy and security. And as we know, healthcare has been kind of really part and parcel of the liberal brand in the last for a long time now. And so this is a manifestation of an economic policy agenda, and where some of the social policy levers kind of fit in and dovetail with that agenda. And so, I mean, I think my big question mark, perhaps for future budgets, is, is this a bit of an anomaly, or is this kind of the way it's going to be for the next number of years, due to fiscal restraint and retrenchment needs? But I think that. I guess the proof will be in the pudding, and but for the time being, we see some very targeted investments in health policy and healthcare, but that don't really speak to pursuing social policy as an end of itself, more pursuing social policy as a means to supporting economic growth and prosperity.
Um, I like how you frame that. When I look at this budget, my big takeaway is thinking about perhaps this is a little bit more of a health budget than we would have expected, which shouldn't have been a surprise upon reflection, because the platform did lay out a number of investments, and we'll go through it. But there's lots still in the platform that has not been invested on, but it very much aligned with their health policy platform. So that would be point one. Point two, to your point, Marcel, it is a broader economic document, but that drove a thematic focus throughout all the pages. So I felt like this budget actually, from one chapter to the next, had far more connectivity than previous budgets we've seen. And I'll use a tangible example, which is why it's kind of a hard one for us to debate in our little health brains. You had a 2019 budget that had the front page as pharmacare, and the entire theme of the budget was on a particular single delivery announcement. And that's a challenging thing to then wrap a whole narrative around a budget when your front page is actually on one specific program, as compared to what are the priorities overarchingly for the government, and then how are we articulating what we're doing underneath it. It's just a very different budget than what we've seen under the Trudeau framing, which is also why we might step back and say, oh, is it as much of a health budget as was before? But I was pleasantly surprised to see a couple of even above the fold targeted funding initiatives, whether it be for the Terry Fox Foundation or otherwise. So interesting to unpack. Why don't we keep rolling?
Yeah, so we can dive into perhaps off the top, as Peter mentioned, kind of what's missing. We did go back and take a hard look at the 2025 Liberal Party platform to see what, from a health perspective, didn't make the cut into this budget. Something that is worth keeping in mind is that a platform is designed to be a document that outlines a 4-year plan. So something not making it into this first budget doesn't necessarily mean it's forever off the table. And additionally, while it's often the case that people who are working on budget have some experience from within government, it's usually political staffers that are involved in some ministerial offices or otherwise. The document is primarily a political document. And so once a party gets voted in and faces the reality of what platform commitments require, both logistically and financially, to launch it, it can impact timelines and the ability to actually follow through on some of those commitments. With that in mind, there were some more glaring pieces that did not show up in this budget. Perhaps the one that people are most aware of and that's received quite a bit of attention so far is around mental health and substance use. This has been highlighted by Minister Michelle as a really key priority for her. And so the lack of new funding for initiatives under this area was a bit of a surprise. There were several initiatives such as the Youth Mental Health Fund, a one-time top-up to the Emergency Treatment Fund, and the financial commitment to CAHR and the Canadian Institute of Public Safety Research and Treatment for Mental Health for First Responders. All of those were costed in the platform to have funding starting in 2025-26. So interesting that they did not make it. With that said, there have been comments from Minister Michelle that they are looking at ways to streamline programming under the mental health and substance use space. And so there may be some more coming. This is all likely just tied to the budget reduction exercise that they're undergoing, and we'll be keeping a close eye on that piece. Another piece that you've likely seen is pharmacare. There was no additional funding for pharmacare included in this budget. However, the new government also did not commit to signing new agreements through the election period. In fact, there was quite a shift from the previous government's language around this. They had committed to protect the pharmacare that had already existed. So not necessarily a shock that there was no new funding in here, but a pretty strong signal from this government that they're not necessarily looking to expand on the pharmacare agreements at this time. Health workforce, there were a couple of notable pieces related to the health workforce that were included in platform but didn't show up in this budget. For example, the administrative burden on doctors, that they had costed about 100 million a year to start reducing that administrative burden, something that physicians have been advocating to for some time. And movement on national licensure. Important to note that there have been discussions kind of on the federal, provincial, territorial level on national licensure. And so there does seem to be some movement on that space without it needing to be in budget. There's not necessarily a space where the feds can spend in that space effectively to make progress. But with that said, a couple pieces there that were missing. Another thing that was interesting and kind of tangentially related to the health workforce is there was a commitment to a new practice fund for family doctors. While this is more tied to infrastructure, the commitment was targeted at supporting to help new doctors start up their clinics and offset some of the debt that they would take on during that process, where they're already pretty strapped with debt coming out of school. While there were some pretty significant investments into health infrastructure, which we'll get into momentarily, this particular piece doesn't seem to align well with the language for the health infrastructure fund, which is much more targeted at kind of acute care pieces, judging by the language that's in the budget, whereas the new practice fund would be more in the primary care space. So that's an interesting one to not have seen in there. Women's and reproductive health was kind of a pretty big space where there were no budget commitments. The platform had a wide range of interesting commitments when it comes to this space. Notably, none of them showed up in this year's budget. There were commitments on women's health data, sexual and reproductive health fund, an IVF program, and research into postpartum mental health, all of which, except for the sexual and reproductive health fund, were committed to receive funding starting in this fiscal year. So the fact that none of those made it in is quite interesting. And then lastly, in the digital health and innovation space, the connected care commitment, in the short term, there's not actually much funding required for this piece. The platform item was more related to the previous government's data legislation or interoperability legislation, C72. We are still hearing that there is a keen interest on this government's part to move forward with that work. And so we're monitoring. It's likely that they will retable that previous legislation. So the fact it wasn't in the budget isn't necessarily tied again to it not moving forward. The Task Force for Public Healthcare Innovation, there was a commitment to invest and scale up made in Canada public healthcare solutions, leverage and improve the quality of data, and evaluate and ensure accountability and public investments in healthcare. There was no funding committed to this in the platform. So again, not necessarily meaning it's not moving ahead, but there's been very little intel on this and if there's an interest in moving forward with it. So just noting that it also wasn't in there. And lastly, InfoWay and the other pan-Canadian health organizations, there was nothing in the platform directly tied to InfoWay, but it is interesting to note that the current funding stream for InfoWay is winding down at the end of this fiscal year. So we'll be watching this one closely to kind of see what the future of this and the other pan-Canadian health organizations look like in the time of budget reductions and streamlining within this government and what that means moving forward.
There's a couple of things I was thinking of that I might add. Also notable that a number of the commitments from the previous government, particularly around national formulary, bulk purchasing, that have been mentioned in budgets numerous times over the last 10 years in this new government, not there. A very clear departure from some of those policies that we've seen in the past. Some of the things that were not mentioned in the budget, to Jill's point, and I'm going to put the commitment to reduce access, the time to access drugs in this bucket as well too. In the platform, it didn't have any financial commitment related to it, so it looks like the government would be looking to policy streams to solve for it. They don't have a number related to it, so again, not particularly surprising that it's not in the budget because of that. But it would also mean that either there is no legislative authorities that they would require, or, and this kind of gets to some of what Joe was saying as well too, if there's not a thematic fit for that legislative authority to fit into an omnibus bill, because there are lots of legislative authorities related to this bill. If they're not in there, it might mean that there's not a thematic approach, or they want to take the opportunity to highlight it in the chamber. I would say, and I'm not surprised that a lot of the there is a lot of legislation tied to this bill, recognizing that the ability for the government to move legislation through this parliament is going to be very difficult.
All right.
Let's keep going. So, Marcel, I think you're kicking us off.
Yeah, I'm going to pick this one up. So this one didn't really play very heavily on budget day in the following days. It's kind of come up in a couple of recent newspaper articles, but I mean, the government kind of played it safe on health transfers in the budget. It was one of those things that, you know, is being kind of protected, transfers to provinces, transfers to individuals, protected from fiscal restraints and budget cuts. But the way that translates into the health sector is really interesting. You know, they have protected major federal transfers to provinces. That means the Canada Health Transfer, the Canada Social Transfer, equalization, territorial formula financing. But when it comes to other transfers to provinces, such as transfers in the context of bilateral agreements in the health sector, and now we've seen several rounds of these agreements over the last 10 years, the initial mental health and home care ones, and there was a virtual care series of agreements, also agreements from the Working Together funding deal with the provinces, and another set around aging with dignity that captured long-term care and other community services. And then there were the ones relating to drugs for rare diseases and pharmacare. So they've chosen not to extend that same protection in terms of an ongoing commitment. So those deals are protected insofar as the deals themselves, you know, have a start date and an end date. But once that end date comes, there is no commitment to renew those deals. And in fact, it appears that they are saying they're not going to renew, for example, the home care and mental health funding deals when they expire in 2027. Same thing for the long-term care funding deals that sunsets in 2028. And so this is a significant departure, I think, from the past 10 years. And I think it marks a bit of a line in the sand. And I think provinces will be paying attention to this. You know, I think the rationale to get provinces into this kind of way of working through bilateral deals was, you know, this is efficient. It allows the feds to target money in particular areas. It's very flexible to jurisdictional needs and so on. But the flip side of it is that these are time-limited agreements. They are generally flat amounts per year. They don't grow. Then there's no escalator. And the feds have a lot more leeway to ratchet these back once the agreements are over and not renew them, or renew them at a lower level. So I think this is a bit of a shot across the bow, potentially, that provinces will be concerned about, because they have said before, and Premier Ford said this the last time around, he mentioned the home care and mental health funding expiring. And there's this general, I think, discourse from the provinces about the reliability of the federal government when it comes to funding healthcare. So this will play into that perception that the feds are an unreliable partner to fund healthcare. Yes, there's the CHT that will continue to grow, but bilateral agreements, they can come and go at the whim of the government. And on the CHT, just to close on that, I mean, the first 5 years of the Working Together deal with the provinces includes a commitment to increase the CHT at 5% per year. That will end after the initial 5-year period in 2028. And then it reverts back to the old formula of growth in GDP, or the minimum floor of 3%. And given how slowly our economy is likely to grow over the next few years, I think we're likely to see a 3%-ish growth in the CHT escalator And that will contrast significantly with the growth in health spending, which last year grew at 5.7%. We'll see when CIHI releases their new national health expenditure data later this month, whether that will continue. But that gap between the rate of growth in federal spending and the rate of growth in provincial spending will again become a lightning rod issue that will be sure to get premiers, I think, riled up and making demands for the federal government to extend that 5% CHT escalator for longer than the initial 5 years.
I think if we go back to 2015 and then Liberal leader Trudeau's commitment to strike a new relationship with provinces and territories, I think on healthcare particularly, I think they can largely say that they did that, they were successful. You know, we had Marcel and I in those early days had that initial run-in with provinces, trying to flip to a bilateral versus just an increase to the CHT. That was bumpy, but the bilaterals turned into a really effective tool for COVID and have been an effective tool since. And up until recently, the most recent rounds of bilaterals, which I think, included $40 to $50 billion of net new funding specifically for several for initiatives. So the provinces haven't had to have the traditional fight that they usually have. You'll remember about 10 years ago, premiers were coming to Ottawa. In fact, the day the world shut down is when all the premiers were coming to Ottawa for COVID to say, we need a new relationship. You need to increase the CHT. And the feds did increase the CHT temporarily to 5%. So the debate that we've had every couple of years for the last several decades is going to come back in full force. And you saw that if Marcel had flagged for us and we shared it around, and we'll probably put it in Health on the Hill this week, that CTV article with a couple of comments from provinces saying it's time for the feds to pony up. That fight of feds, you need to give more to healthcare, and you're cutting healthcare funding, and then the feds arguing that no, we're increasing it because the CHT is going up, and it's a public comms war over decreasing the increase is a cut versus still an increase. That whole fight we're about to have all over again. And there will be a very interesting space for stakeholders to occupy because the standard has now been set that we're talking about specific outcomes for dollars. And this government will need to decide how they want to handle the premiers. They need to either say that feds were broke, we can't give you money, which they're going to have to withstand that onslaught from both stakeholders and premiers. I would argue something will have to give somewhere. They will need to decide whether or not it's consolidated revenue versus what are the biggest issues in healthcare they want to solve for. Like they will have decisions to make, whether or not, and not making a decision is as I like to say, still a decision, but they'll need to make those decisions. So this is going to be, it's a quiet year on this now. In the next year, this is going to take up more and more time and space. Anything else?
No, I think you've covered everything that I would say.
Cool.
Good to go.
Let's do it. Oh, and this one's me. So, I went back, my starting place for thinking about the spending reductions was to actually look at the cuts under the Harper government. And this is actually Marcel's voice in my brain from talking about this a couple of years ago, because Marcel was in the public service at the time. And I remember when I joined the federal government, there was always stories about the dark days of the Harper era when the public service was cut so much in one day. To put it into context, the Harper government reduced the public service, or at least committed to reduce it, by 4.8%. The commitment in this budget from the Carney government is twice that, at 10%. The trajectory of the public services growth in the last 10 years is extraordinarily high. And the budget articulated the number of Canadians and the number of public servants per capita per Canadians, and has made the argument that it's too big of an organization for what Canada needs. How it will be implemented, we have been able to see a little bit of that. Where things, and what I mean by that is, grants and contribution programs being sunsetted And we will continue to see that over the next year. That's like a couple of years in the making, frankly. There's lots of this is already being sunset. A lot of attrition, a lot of reorganization. I think we've talked in the past about, Health Canada's strategic policy branch is now the health policy branch. A number of the individuals or the size of some of the branches in Health Canada have been reduced. At one point you had a very robust pharmacare directorate, or you had a drugs for diseases directorate. That the responsibilities for those have been consolidated into different employees to save on headcount. It will require much more difficult decision-making on where you are going to reduce the number of employees, because that's the majority of the spend that Health Canada, ESDC, some of these departments that we look to, it's staffing costs where you'll make those savings. CIHR is exempt to a point. They have to reduce their spending by 2%, not 15%. But then there are the other organizations like Public Health Agency. There are some aspects of Health Canada that you would wonder, how are you going to proceed with meeting these commitments? So health products and food branch, if you're still digging yourself out of a hole on a delay in approving drugs, is this the time you're going to want to reduce your capacity? So then this flips to, well, how can we do more with less, which is literally what they're going to have to figure out doing. I would contend, and I'd welcome, as much as Marcel and Joe would like to comment on this, but I would contend there's lots of room for improvement in productivity within the federal public service. It is a very, I don't want to say archaic, that's not fair. And especially to those in the public service that are listening right now, don't take it as an unfair comment. But there is still a lot of paper-based systems that have been advanced since COVID, admittedly. There's still a lot of processes that have been in place for many years. And there's probably on the regulatory front, it is timely to do a review of some of the processes that government has. And by that, I mean, it could be processes with stakeholders, application process, whatever it might be. Because if you haven't looked at something in 10 years, it's probably a good time to take a look at that again and see if there's a better way to do things. And the government, is articulating, we need to figure out how to use tools better. How do we use AI? We're all figuring that out. In fact, we can have another webinar on how we're using AI at one point, if that would be helpful, because it is extraordinarily helpful. So there are things that they can do. That's what I would contend. And productivity is something that they can turn their minds to. Yeah, that's not to say it's going to be easy, because these are big reductions, and the government will have to figure out how, in the risk-adverse nature of the federal system, they're going to meet these targets. And the budget doesn't spell out how. It's now over to departments to figure it out. I don't know, Marcel, if you wanted to jump in on this one.
I guess I would just add, and there was a question in the chat about your very last point, Peter, is there any detail on these cuts? And the answer is no. I mean, there's an annex in the budget with each department has a few paragraphs. I think Health Canada's is one of the briefest commentary, and you would be hard pressed to get any sense of how the department is planning to implement the $300 million plus cuts that they've been handed or have committed to. So that remains to be largely seen, and take into account too that Health Canada is, it's a huge department now in terms of personnel and spending. About 10,000 staff, about 11 billion in spending, way bigger than it was when I was there, and driven in large part by the dental care plan. So there's a lot of money, a lot of people. But the regulatory side of the department is really, about 95% of the people's part of the equation. And so if there are cuts affecting, the operations of the department, a good chunk of those will probably come on the regulatory side. I assume some will come on the G's and C's side as well. Those are harder to, once you kind of carve out the transfers to provinces and individual benefits, those are harder to weather politically. So it'll be really interesting to see those numbers once they are made public, and those cuts and how they're going to land in the department. But really nothing to go off on at this stage.
Maria, to your question, I'll just answer it very quickly. If there's a program that had a constrained number of years that it would be running, it is unlikely it would be renewed. That is the way I would frame that. And then Mr. Hogue, thank you, Steve, for joining. That does not surprise me that it's not on the agenda, and I appreciate you sharing that around. This is the break year. The next set of agreements expire next year, and I think that's the year in which the provinces will make that fight known. I think there's a lot of other priorities right now, and I don't think this fight would make sense for provinces to take it now, even though arguably you would want to start something earlier in the process, a year in advance. But the public, it's a public comms war, so they're going to have that when they can strike while the iron's hot, which is the years that funding expires. Okay, we're going to move a little bit faster because we're really going into the weeds here, and I hope you don't mind that, but we'll keep going.
Yes. So next up is the Health Infrastructure Fund. So as I mentioned a little bit earlier, this was a pretty significant investment in the health space. That was a bit of a surprise. There was about $5 billion dedicated specifically to the Health Infrastructure Fund under the provincial and territorial investment kind of stream on the Built Communities Fund. How many times can we say fund? So this is the first time in decades that the government of Canada is committing to fund actual health infrastructure. This was a key pillar of the Liberal platform. It also did show up similarly in the Conservative platform. Interestingly, this angle was largely born in the platform space from the fact that a lot of key acute health spaces, particularly hospitals, in the smaller rural remote communities are very quickly falling into being very outdated. They need a lot of updates. They need retrofitting, and investing in these kind of upgrades for provinces and territories can be quite expensive. As you'll see on the slide here, the new Civic Hospital campus in Ottawa alone will cost $2.8 billion. And so what we often see from provinces and territories is these investments going into the bigger centers. And this can kind of create kind of a cycle issue where the rural remote communities are seeing more and more issues with their hospitals. They're not getting the physicians and nurses into the spaces that they may need to help address the closures that they're facing. And so part of trying to spur more investment in a lot of these spaces is the federal government is putting some money on the table. Again, it's $5 billion over 3 years. So looking at the amount that just one hospital will cost in Ottawa, this is quite nominal compared to what might be needed by provinces and territories. But it's worth noting that there is a requirement under the fund to cost share. So provinces and territories will have to chip in for any of the projects that the feds agree to help them fund. So that can help potentially even double the amount of the investment that the federal government is putting on the table. So this can be a really interesting way to kind of spur the investments in this space and hopefully try to upgrade some hospitals and some care centers. Something I do want to note is that in the platform commitment, there were acknowledgements of other types of infrastructure. So for example, long-term care was noted. The words long-term care did not show up in the budget commitment, but with that said, the funding commitment for this one doesn't start until 2026-27. There's likely still a lot of background work going on what exactly this fund is going to look like, who is going to be eligible for it, what the funding mechanisms look like. So there is definitely some time here if there's interest in this fund for folks to go and advocate and help to try to influence, what this could look like and who could have access to it. Peter, Marcel, I don't know if there's anything you'd like to add.
Yeah, I just take a look at the budget itself and see some of the examples of initiatives they put in there. They're really looking to upscale existing institutions. What are some sort of niche capital spends that can have low cost, high yield, as we note in the Marcel who flagged this one. You know, just the cost of a new health system alone or hospital alone is extraordinarily high. But, you know, they give some examples to help understand what they're looking to fund. Marcel?
Yeah, and the only thing, not to belittle the number here, but as noted in the slide, there's $15 billion annually of spending in the healthcare system by provinces on healthcare infrastructure. So the provinces could easily, you know, say, well, we're planning to spend, you know, X this year, so they want federal matching. I think it might be difficult to say that the feds themselves will lever an additional $5 billion beyond what provinces already spend in healthcare. I think it'll be more so the case the federal contribution will add to what the provinces are spending. And I think the value of this investment is more in the precedent that it sets, because for such a long time now, the feds have refused to fund healthcare infrastructure. So this opens a crack in the door and potentially some larger investments in the future.
Thanks, Marcel.
Absolutely. Thank you. All right. Health research. So there really wasn't a significant focus on health research in this budget. There were a few investments. They were largely targeted towards kind of recruitment of international talent, not so much going towards Canadian researchers here at home. With that said, there was funding committed to enhancements to the SHRED program and also the Canadian Foundation for Innovation. I want to specifically note the CFI investment because I think it really demonstrates how current investments in existing spaces have the potential to shift and change depending on what the government's priorities are. So we have seen from this government that infrastructure space is of keen interest to them and building up infrastructure. The Canadian Foundation for Innovation does largely go towards infrastructure spend in the research space. And so it's not surprising that this is kind of an angle that they are going towards when it comes to investment in research. The other piece that I wanted to kind of really hit on again, I know Peter covered it with the budget reductions, but I do think it is worth remembering that the cap on CIHR budget cuts is 2% as opposed to the 15% that other departments are facing. While it can be seen as, you know, all budget cuts in the research space are obviously a hit, it's already a very underfunded space in Canada. It could have been a lot worse. And so I think it is worth noting that as a bit of a win. The other piece is we highlighted there the $80 million to the Terry Fox Foundation for Oncology Research. This is an interesting one to kind of really keep an eye on because it does demonstrate some level of willingness from the government to do some targeted investments if they're in a space that aligns with what the government's priorities are. So this is one that we're watching closely and analyzing closely to see how this can kind of be utilized to the advantage of other advocates in the space.
I would say keep your questions coming in as you have them, because we are running out of time as we go through this. It's substantive. So more questions you can ask as we're going, the better.
Yeah.
Thank you.
Perfect.
Carry on.
All right.
So there isn't, and this is not a surprising, this isn't a budget that would have articulated a specific strategy for the life sciences sector, as we've seen in previous governments. There are a number of things that are percolating south of the border. Most favored nation, CUSMA. We do have some slides on that, which we won't be able to get through too much today, but we can talk about it and share these slides around and have individual chats later. But the one thing I would say is that the life sciences sector is very clearly part of the broader narrative initiatives within the budget framework and initiatives within the budget itself. Articulating how the government would fund to develop and commercialize that dual civilian military tech includes the life sciences sector. There are opportunities under the manufacturing fund as well too, as we understand it. There is the desire to make some life sciences systems more productive. That was specifically mentioned on the Patented Medicines Prices Review Board. You'd think 10 years in, I'd say that a lot cleaner, but I'll just keep everybody else in the club with me who can't. And then I would imagine, it didn't say anything, but the fact that Health Emergency Readiness Canada wasn't in there, as they figure out what their space is, I actually think the language of the budget works really well for the security of supply intent of that organization. I suspect we'll learn a little bit more about what role they'll play over time. So I'll leave it there and we'll keep moving.
Okay, this is just a bit of a kind of a snapshot at what health policy looks like under Carney and versus Trudeau, and there's nothing really earth-shattering here. I think we've covered a lot of this already. I mean, the drivers clearly for both governments were very different. Under Trudeau, the pandemic loomed very large. There was the NDP supply and confidence agreement that drove many key investments versus where we're at now, where it's really all about national security and tariffs and affordability. And so in terms of key directions for both governments, you see that reflected in, Trudeau being all about deals with the provinces, shared health priorities, working together, aging with dignity, pharmacare, drugs for rare diseases, and so on and so forth. So big focus on these bilateral deals, also using legislation to make inroads in some areas. Whereas for Carney now, we're talking about things that have to do with the economy and with economic growth and making our federation work better and reducing barriers to trade and so on. So I think that really encapsulates a very big dichotomy between the two governments. We still haven't seen, the true colors of the Carney government yet in terms of how they will be dealing with the provinces when some of these skirmishes will happen on the health file. There's a piece of policy that is currently under discussion with the provinces called the CHA, Canada Health Act Services Policy. And we know the provinces have had concerns about the implementation of that, which really would make nurse practitioner services, for example, insured services, and would require provinces to regulate that. Are they interested in doing that? Will they push back sufficiently that Mark Carney backs down on that proposal? I don't know. And we still haven't seen Bill C-72 and interoperability come back to the House, and that's another one that is in abeyance. Probably a bit more uncontroversial with the provinces, but remains to be seen where we go with that. Back to you, Peter, or anyone else who wants to comment.
So we'll fly through a couple different updates that you're probably curious on outside the budget. As I alluded to, so the CUSMA process is underway. There's ongoing negotiations. There's that public consultation that will be a closing, I believe, sometime in November. Then we'll head into that bilateral negotiation phase, which would be behind closed doors. But I mean, at the same time, this could completely go out the window, whether or not Trump even wants to sign this at the end of the day. But this will suck up time, energy, and capacity. There will be an ongoing debate on the value of a trilateral agreement versus perhaps individual bilateral agreements, and how the ongoing discussions on trade play into CUSMA will be seen as well too. So it's nebulous because of the moving parts, and I'll leave it there. On most favored nations, it wasn't profiled by the government, but it is a significant contributor to a lot of discussions that I think are happening south and north of the border. And if I'm to encapsulate it in a really simple framing, and people can challenge me if I understand it correctly or not, because I probably don't. But how I look at it is that if the United States is saying, listen, we're paying way too much money for drugs, and we're funding a lot of the R&D, and other countries are paying less for drugs and they're benefiting from that, and the United States is now saying, we want to have some prices controlled to lower them, that would impact margins across the globe. And those margins would likely need to come from somewhere. So are those margins going to come from increased prices in other jurisdictions? Are those margins going to come from decreased investment, access to clinical trials? Like, where is it going to come from? It doesn't just go away. We're in a capitalist global economy, and that revenue will need to be replaced from somewhere. And I don't think folks really know where. There's another debate in there where people can say, well, how much is pharma making? What is enough? I would expect that publicly traded companies on the stock market would have a different driver on how to achieve that, and this is the world we live in. So not to turn this into a macro debate over how is everything funded, but there are going to be pressures on different countries to replace that revenue. And we're already seeing movements. Look at what the United Kingdom has done to try and respond to it. You'll also see individual companies. I think Stephen Hoag's on here, not to call you out, but Pfizer was one of the first, because I think a lot of this is creating some predictability within the sector and industry as well as securing up where your supply chains are. I think from a Canadian standpoint, if I can summarize it, our drugs and devices are imported to Canada from all over the world, a big chunk from Europe, a chunk from the United States, not to say that it's insignificant. Our supply chains are diverse. Our challenge is that we're not enough of a market for a massive manufacturing base to live here just to support a Canadian population. So Canada has some challenges that we'll have to figure out. And I think governments have started to move in a really smart direction, thinking about, well, how can we deal with some irritants that might exist on the coordination of our services and our review processes and the speed of which we're doing those. That conversation is very clearly underway. I am convinced that there's a bigger conversation to have over what sort of country we'll want to be, what sort of drugs do we want covered, how much are we willing to spend, what is too much. A lot of these conversations are inherently political, and we set up systems to not actually have them as political conversations. So I think that this will be evolving conversation if this continues to come to a head, especially if the United States does drive prices down. There will be no choice but to have a more forward-thinking, reflective, principle-based conversation to have, which I don't know if our government leaders are prepared to have that at this time. Elected government leaders, for the record.
So maybe continuing on the pharmaceuticals theme, as Peter mentioned and Jill as well, the rare disease file was not mentioned in the budget. Pharmacare had a brief mention at the beginning of the budget, but only to say that it was going to be protected. So on the rare disease file, these bilateral deals that were struck a couple of years ago, they go on to the end of 26-27, so March 2027. And so, time is going to start to run tight in 2026 to renew these, and we expect that there's going to be some discussion about that. These are commitments essentially that provinces have made to improve access to drugs for rare diseases to their residents, and backstopped by federal funding. So I have a hard time believing that the government would renege on the renewal of those agreements, because those are very difficult things to do, to turn back kind of the clock on access to these high cost drugs in many cases for desperate families with kids that have a rare disease, for example. But certainly the budget has not given a lot of cause for optimism about the renewal of these bilateral agreements and these types of bilateral agreements. So I think stakeholders will want to take note of that and kind of gear up for making the case as to why these types of agreements need to be renewed, including the ones for rare diseases. On pharmacare, and there was a question about this earlier in the chat, the government has committed to protecting the deals that are in place and has kind of been on the fence a bit about saying whether other deals would be struck. There was no new money provided in the budget for that. If I was a province looking at this, a province that hasn't signed a deal, I would be thinking like, I'm not sure I want to commit to doing this, because I have to make a commitment to my constituents saying I'm going to ensure diabetes drugs and contraceptives universally for the population, and then be potentially at risk for a future federal government or this one that might pull back on those deals. I don't think that's going to be a tenable arrangement for many provinces. Anyways, that's my take on that.
I might just add, I know we're short on time, but the real world evidence is something that needs to, and likely is going to be, a moving piece within the system. And I'm not necessarily articulating on collecting real world evidence, but the challenge will be how do you establish frameworks in order to incorporate real world evidence into decision making? And I mean that from a regulatory structure all the way down to pricing agreements and the adaptability of collecting RWE on the ground. There's lots of potential there. I know it's something that's going to keep coming up. But I think there will be, and kind of connected with my comments from before, it's going to be the difficult part is figuring out how do we get good RWE, how do we make sure we understand its bias, and then how do we incorporate that RWE into decision making so that that we can make more effective decisions over time on drugs and devices. So I'll just leave that there. But it's not anywhere here, but it's something live I think is worth flagging.
Perfect. All right, so continuing on, I'll go pretty quickly, just conscious of time. We did cover a lot of what we wanted to touch on health human resources already. So jumping to AI, the thing I primarily wanted to note here is that, interestingly, with a government that's so focused on AI and has been pushing AI, there was actually quite minimal investment in this sector in budget 2025. Most of the funding that was committed is noted as being sourced by funds previously provisioned in the fiscal framework. So that means they're being repurposed from other avenues. With that said, the Minister of Artificial Intelligence is set to present an updated pan-Canadian AI strategy by the end of 2025. So what we anticipate is that more funding in this space will likely follow that, so that the funding can be invested in a way that aligns with the future strategy. So it's not necessarily meaning that nothing's coming, but that they're trying to invest more intelligently in that space. Red tape reduction. So primarily what I wanted to highlight here was, as Peter mentioned, the time to list piece. So the government across the board is trying to find ways to reduce red tape. It is a speaking point that the Conservatives had over the last couple of years that the new Liberal leader adopted throughout the throughout the election period. The government came back with a large report in September on actions they were going to be taking. Health Canada and PHAC also issued their independent report in this space. They provided progress updates on things that they had already undertaken, and also outlined 30 ongoing and future initiatives across their various programs in the two departments to try to target red tape reduction. One of the things that they noted was that they were going to move forward within the next 2 years on relying on more foreign regulators and the decisions that they're making in order to try to streamline the pharmaceutical drug and device approvals in the Canadian space. So we'll be watching that one closely for opportunities to engage and to weigh in on that process. And Marcel already largely covered the CHA services policy piece, so we're good on that.
So I would just wrap up. It's a really unproductive parliament because the Liberals will have a challenge getting things through committee. That's where they have to work with the Bloc and the Conservatives. They're 2 seat side majority, and it's chaos, organized chaos right now. Why don't I leave it at that? But we'll keep rolling. The fact that the polls are tight is not surprising. You can go to the next slide. It's okay. The polls are tight. Carney's leadership numbers are really high. I think the Liberals would be in trouble if they had a new competent Conservative leader, because affordability and the desire for change is still really high. So the Carney government has to figure out how to get this through the House. They may not. We could be into an election. We could have a really interesting debate over whether or not they want that. And maybe the Conservatives want that too, for goodness sake. It's really unpredictable. And anybody who says they know what's going to happen, I take it as speculation, because I don't think any of us really do. There's going to be a lot that's in the detail, whether it's funding details on what different programs exist, what's happening with GNCs, what's sunsetting. And you really need to make sure that your proposals are targeting investments. I will end this webinar by saying, on the next slide, 3 things. 1, budget votes are coming up. We'll figure out the fate on this in the next couple weeks. The Liberals are short two votes. 2, we'll learn the below the line things that weren't in the public domain over time as departments learn them. And 3, if not an election, Pierre Poilievre's leadership vote will be the next big moment at the end of January. We'll leave it there. We're at 1 o'clock. Thank you all for joining. Have yourself a lovely day.